The government's One Hospital Command Center is trying to keep up with the rising number of calls. The command center oversees the coordination and referral of COVID patients across health facilities. And we now talk to Health Undersecretary and Treatment Czar Leopoldo Vega. Good morning, Yusek. Thanks for taking our call.
Good morning, Ria, and good morning to all the listeners in CNN.
Now, Yusek, we understand that most hospitals in Metro Manila are full. Now, where should patients who need care go? Where do they go? Where are they referred to?
Ria, I think that was one of the objective and the concept of the One Hospital Command when we set it up last year in August and September of 2020. The main reason behind that was we wanted to do a coordinated care and referral systems among the different private and public hospitals here in Metro Manila and the neighboring regions. And what we've done so far is that we have been able to treatment like an ICU with no available vacancy in the metropolis towards Region 3 and Region 4. But the pandemic right now, the surge that we've been experiencing the last few days, wherein we did hit the 9,000 to 10,000 mark, which is roughly double the pandemic size that we had in last year. Also burdened not just the hospital, but burdened the One Hospital Command in terms of transactional calls. And this is the reason why we're being challenged, and we would like to seek the patience and understanding of the public in terms of connectivity issues. But rest assured, for the One Hospital Command, our goal remains the same. We are here to coordinate care and referral systems and possibly do more expansion of the different hospitals around through the making or implementation of modular field hospitals.
Yusek, can you take us through the process of using One Hospital Command? So a patient who needs care or their family members will call the hotline. What happens?
When you call a hotline, this will actually fall in there are three numbers, one PLDT, one Smart, and the other is Globe, and the other is, of course, a landline. The weakness that we have right now with the One Hospital Command is that we don't have the sophistication of a telecommunication system because it was just set up. So we don't have a PABX or call forwarding. So sometimes these calls, wherein you call the Globe or even the Smart, would remain ringing, but some of these agents are engaged. So we're trying to fix this by making sure that we can have the necessary telecommunications upgrade. So when you call these numbers, this will fall to a call center agent. And definitely, if these are frequently asked questions, he can do that easily. But when they try to look for hospitals, and most of the hospitals we have in the dashboard and look for a hospital. That's the hardest time because sometimes we can't locate hospitals within the metropolis that can actually admit these patients. So we refer this to other institutions, but sometimes the patients would choose the hospitals that they would have. And secondly, if there are no vacancies, especially with COVID wards or isolation, or even TTMFs, because we also refer these patients to isolation facilities, then we would coordinate them to the different LGUs or to other neighboring regions.
All right. So when it comes to the other hospitals or places that you're referring them to, how far from Metro Manila are these exactly?
Roughly, we have a regional hospital command, but we can actually coordinate with in Region 3. And basically, there are private hospitals there that we can actually also see from our dashboard where the vacancies are, and Region 4. So if you need a government institution in Region 4A, then we would refer you to the Batangas Medical Center because that's the level 3 hospital out there. And in Region 3, we have two. We have JP Lingad, which is also a level 3. and one in Nueva Ecija with also a level 3 institution, Paulino Garcia. So these are the main government institutions that we can refer. Of course, if the patient would need private care, then we can refer them to private institutions in Region 3 and Region 4. And we also hope that we can find space for them here in...
All right, Yusek, can you hear me?
Yes, I can. Yes,
all right.
I can.
So you mentioned earlier, if a patient calls the hotline, whether that's through Smart, Globe, or the landline, if they are able to actually talk to a call center agent, these call center agents, you said they have a dashboard, where they can see what hospitals there are. Is that dashboard reflecting real-time numbers?
Yeah, these are real-time numbers because these are actually encoded by the different data managers of both public and private institutions. We have set this up since last year because we really wanted to see the utilization or occupancy of the different hospitals. So that, we do have a dashboard wherein these hospitals are actually on real time, actually also upgrade or current time on real time encode the present utilization rate.
All right, so are you able to share with us the numbers for Metro Manila hospitals in terms of percentages? How full are they?
In terms of percentages, just an overview of when you say COVID beds and isolation wards, which is really here in the metropolis, it's roughly about more than it's a moderate risk of 70%. Because this covers level 1, 2, and 3. But when you say a level 3 hospital, the big hospitals like government and the private institutions, then it's high risk occupancy, meaning to say that these COVID beds and isolation beds could reach as much as 80 to 85%. But in some areas, especially with the intensive care units, Manila, Quezon City, Taguig, and of course, I think Malabon, they are already in a very high risk category because sometimes they would already report that they almost have 85 to 90% or more than 90%, which is already a critical risk position.
Right. Now, the government is trying to control this surge through the ECQ. Yusek, do you think a week of ECQ is enough to decongest these hospitals and at least make the situation manageable for our healthcare system?
Yeah, I think this 1 week can buy us time in terms of properly referring most of these mild cases towards the TTMFs because we noticed also in our dashboard that a lot of mild and asymptomatic cases have been admitted in some hospitals, although these mild cases can be managed in isolation facilities. So in this 1 week time, I think we can buy time in terms of making sure that the resources are there. And we do hope that these numbers will go down, but if there is going to be an uptick again, I think we need to heighten more restrictions.
All right, thank you so much for that, DOH Undersecretary and Treatment Czar Leopoldo Vega.